7:45 right now. Governor Wolf and his administration say there are no plans right now to issue any more masking mandates across Pennsylvania. That said, COVID-19 cases have increased by 1,600 a day on average over the last month. And joining us this morning on the Fox 43 Capitol Beat is to talk about this surge and what the Commonwealth's next moves are is Acting Health Secretary Alison Beam. Thank you so much for joining us this morning. You and the governor, we just mentioned, keep saying the focus is on getting people vaccinated. How do you convince people who, to this point, have had every chance to get vaccinated and still have not to decide to get the shot?
Thanks so much for having me, Matt, and good morning. So getting directly to your question about how we're reaching the unvaccinated, we really have decided to invest all of our resources in having it be a hyper-localized effort. If you can remember back in the beginning, a lot of it was about volume, right? Getting as many folks vaccinated as quickly as possible, trying to meet that pent-up demand. We've completely shifted right now, and we know that at this stage, many of the unvaccinated individuals are engaging in educational conversations with their clinicians, speaking with local leaders, pastors, folks that they're neighbors with, and that's what's actually changing hearts and minds. And so we actually have been able to put forward financial assistance to help a lot of our community-based organizations to tailor that specific messaging. But at this stage of the game, it's all about boots on the ground and really engaging individuals to let them learn more about the safety and the efficacy of the vaccine and why they should get vaccinated.
So even though that being said, there's still a lot of people who simply won't get the shot because, well, the government is telling them to get the shot. Is there any thought that maybe loosening that hard sell could help more people and give them more freedom to do so?
So we humbly are readily cognizant of the fact that our voices may not resonate, right? That the governor and I encouraging vaccinations in certain populations is not necessarily going to help. And so again, that's where we know it's a chorus of voices that are going to get us there, right? And so it's bringing in our community-based organizations and other leaders to actually be out front on the messaging that we think is going to get more Pennsylvanians comfortable getting vaccinated.
When it comes to breakthrough cases, Pennsylvania is one of 15 states that does not provide its data publicly. What is holding the Department of Health back from doing so?
So we've been very closely studying breakthrough data to understand better what the actual incidence rate is here in Pennsylvania. And what we're getting ready to do is actually go further than even what the CDC is requiring, in that we're going to be able to not only provide folks information on breakthrough cases that have been hospitalized and tragically passed away, but also looking at what our case incidence rates are. Notably, Pennsylvania is aligned at this stage with the national levels of saying that 97% of those that are hospitalized are unvaccinated and 99% of those that are tragically passing away from COVID are unvaccinated. And so we hope to be able to share much of this data soon, but it is definitely requiring a lot of our resources to make sure that we have data of such integrity to share with folks.
You say soon. What do you have an idea of when soon is? Because I'm just wondering if the data lines up with what the national data is, which basically says if you're vaccinated, even if there is a breakthrough, the chances of you going to the hospital or dying are less than minuscule. Could sharing that data help convince more people to get the shot?
Absolutely. We think that it's a critical piece of information that we want to share with folks to be able to evidence what Pennsylvania's specific experience is. But I think in the meantime, we've been able to use the national data to also put that compelling piece of information in folks' minds.
Got it. Dr. Fauci said yesterday that he feels teachers should be required to get the vaccine. Do you agree with that?
At this stage, Pennsylvania has no intentions of putting vaccination mandates out there in our education space. And so we've talked a lot over the past few weeks about what our plans are for trying to allow there to be in-person instruction for as many students as possible, for as long as possible. And again, vaccinations are part of that, right? They're a layer to that. And so to the extent that teachers can get vaccinated, high school students can get vaccinated, we would strongly encourage them to do so. But we also realize that there's masking, there's social distancing, and there is testing. We have an incredible testing infrastructure that we're going to be offering to schools at no cost on a voluntary basis. And I think all of these layers together are what we're trying to do to put forward a comprehensive plan to preserve in-person instruction safely.
The masking isn't mandatory either, though, and I'm wondering kind of how you feel on that, if more schools should go about masking, and should the state have more guidance? Because a lot of teachers have reached out to us and kind of have been frustrated with the lack of guidance they've received from both the Departments of Education and Health.
So you are correct. There is no statewide mandate for K through 12 at this stage. But what we continue to emphasize for school district leadership, for teachers and others, is the CDC guidance, which did encourage mask wearing in K through 12 indoor settings. And so we want to make sure that folks understand that while we are referencing the CDC guidelines are universal. So vaccinated, unvaccinated, no matter your level of county transmission, there should be mask wearing in schools. And we're hoping that local leaders who have wanted to make a lot of those local decisions throughout this pandemic response adopt those CDC guidelines.
Yesterday, the former acting director of the CDC, Dr. Richard Besser, says he expects schools to shut down more this year because of spread. What is your reaction to that?
This year, we are on a different playing field than we were last year. And one of the key distinctions is vaccinations. We know that those that are not only the teachers and the administrators being able to avail themselves of vaccinations is one fold in it, but even our high school students, and hopefully in the upcoming months, down to age 5 will be approved for vaccination. So school-age children will be able to get vaccinated.
Do you think that will lead to schools staying open, though?
That is exactly our intention, is that by allowing that to be part of our critical response and a true differentiation from last school year, where we didn't have the vaccine in the fall of 2020 to even be thinking about that, that is why we are really emphasizing that for us, instructional models aren't necessarily where we're focusing. Right now, it is everything we can do to preserve in-person instruction safely, and vaccinations are what we see as the differentiation between this year and last.
I want to end on this. Both you and the governor, as we mentioned, said you don't plan on issuing a new mask mandate. But what is the metric that you'd be looking for in order to have to introduce a mask mandate for the state again?
So we have, again, closely been monitoring, as you highlighted at the top. We have 14-day trends that we're continuing to monitor by way of cases and hospitalizations that are both going in the wrong direction right now. And it's incredibly concerning. What we're going to be doing also is working with the General Assembly to understand better what their role can be in putting forward any sort of mitigation measure. Because clearly in May, there was not only an encouragement by the General Assembly to have more involvement in this, but also a vote by Pennsylvanians to allow the General Assembly to have more of a role in these mitigation measures. And so for us, the metric isn't as clear as us working with the General Assembly to put forward any of those mitigation measures.
Acting Secretary of Health, Dr. Alison Beam, thank you so much for joining us this morning on the Fox 43 Capitol Beat.
Thank you so much for having me. Have a good one.